Hello, hello. My name is Jess, and this is Patient POV. And today we are hearing from Stephanie, and I'm so excited for you to hear from her. She is a mom, she is a chronic illness warrior, and I'm so excited for you to hear from her, but we'll jump into that in just a minute. Just a few housekeeping things as always. If you want to find me on Instagram, you can find me at Jess underscore and underscore Elda, which is ELDA. And you can also like and subscribe to the podcast. That means a lot to me. And yeah, that is just very helpful so that you can always hear when things are coming up. And my last bit of housekeeping here is you can go to patientpov.ca. So patientpov.ca, and you can find episodes, you can find updates, resources, the blog, and some freebies are in there as well. Just subscribe with your email and you'll get the password for the freebies, and they're all available to you for completely free. So that is the housekeeping stuff. Last week, we had discussed a little goal to do, which was to do for about 15 minutes a day, try to do one thing without technology for 15 minutes a day for at least 5 days. So hopefully you were able to do that. If not, give it a try this week. But a new challenge for you guys to this week. I don't know about you and where you're located, but it is beautiful weather starting to be this week. And so I really encourage you to spend 10 minutes a day, preferably right when you wake up. But if not, just any point in the day, and spend 10 minutes of the day just outside and trying to get that like sunlight. And so there's been lots of research about how sunlight is really good for you. Sunlight right first thing in the morning is really good for like your circadian rhythm, which is like your awake sleep clock in your brain, um, and your body. And so I really encourage you 10 minutes every day. The goal would be like 5 days out of the 7, but the the best thing would be all 7 days. So try to do that. If you want to just sit and be outside, close your eyes, soak in the breeze, that's a great goal. Or if you want to go for a walk and that be your goal, that is also absolutely wonderful. But you can just grab a blanket and just sit on your porch, and that is also wonderful. So yeah, 10 minutes at least 5 times, hopefully, and preferably in the morning. But if you can get it done, it doesn't matter when, that is absolutely awesome. Yeah, I think that is all the housekeeping things. If you do end up doing the challenge, feel free to tag me on Instagram at Jess underscore and underscore Elda. And I would love to see you participating. So, yeah, let me know if you were able to do it, or you can send me a little DM saying you completed it. And that would be awesome as well. Okay, and I'm so excited for this conversation you're going to get to hear. And so we're just going to jump right in. And I hope everyone has a great week ahead. Thanks, guys. Hello, hello. How are you today?
I'm okay, thank you.
Okay, we were just talking about how it's not the best day. It's a little bit of a flare day, but you're managing through it, eh?
Mhm. Absolutely correct. Managing through.
Yeah. Well, we'll dive into a little bit on what you do in your flare days in just a little bit. But I'm wondering if you can give everyone an introduction on who you are and kind of your health journey background.
My name is Stephanie. I am a 35-year-old mother of 3. My kids are 19, 14, and 8. So, on the younger end, still kind of young, but able to take care of themselves, thank goodness. Um, I have a few autoimmune diseases, chronic illnesses. The first one that I was diagnosed with in 2018 was Wegener's granulomatosis. They found that after 3 years of medical gaslighting and telling me that I had fibromyalgia and all kinds of things.
Mm.
I'm still kind of in denial that I have fibromyalgia, even though I know it's probably there. but it's still on my medical record nonetheless. So fibromyalgia, Wegener's granulomatosis, psoriatic arthritis was the next one I was diagnosed with in 2019. And then recently, ankylosing spondylitis. So I have three herniations, three spinal herniations, one in my neck, one in my lower back, and then another one between my L5 and S1, which is like the very, very bottom of my back, of
Mm,
my spine. And that one is actually pinching the nerves going down both my legs.
mm,
So I have that. I suffer also from chronic migraines. And I think a lot of that has to do with this
mm.
herniated disc in my neck. So that's me in a nutshell.
Yeah. Yeah, no, for sure. And so I'm wondering, as like a little educational piece for anybody listening, would you be able to explain what Wagner's granulomatosis? Did I say that?
Granulomatosis.
Yeah,
Yeah.
mitosis. Okay. Would you
Yeah.
be able to just explain what that is and kind of how it affects you?
Wegener's granulomatosis is it's also called Wegener's disease, and it is a form of vasculitis, which is inflammation of like your blood vessels.
Mm,
It's extremely rare. A lot of people haven't heard of it. I'm an RN, and I didn't even hear about it until I was diagnosed. I had no idea what it was. But there's like certain criteria that you need to meet. There is a very specific lab that my doctor did to test me for that, which also had never heard of that lab. It's called an ANCA. And for Wegener's disease, it's a very specific, I guess, subset of that, because you can have a P, ANCA, or you can have a C, ANCA, and C is very specific for Wegener's disease. And then it goes and tests further. I guess like there's like a subset, kind of think of it as like a little tree. So
mm,
there's ANCA, and then C ANCA is Wegener's, and then it goes and branches off, and you can have either positive MPOs or positive PR3s. And then if you're positive PR3, then it's Wegener's disease. And mine were positive for PR3s. It's complicated, but either way, like things that people with Wegener's disease have are you can have blood clots in your lungs, you can have I guess like nosebleeds is a lot what I have. It can affect your
mm,
sinuses, your lungs, your kidneys. And I kind of feel like a ticking time bomb because
mm.
they have to check me every 3 months, make sure my kidneys are okay. And then, of course, if I have any signs of kidney dysfunction, then I need to go to the doctor right away.
Mm.
But I was on a whole year of Rituxan infusions for that. I had to go, I think it was like every month. I can't remember because, like I said, it was in 2018 when I was first diagnosed. And they had me do a whole year of Rituxan infusions and then told me that I was in remission from that. And since then, I've just been really on biologics and a lot of steroids. So, but it's been under control. And I know it's really complicated, like a really complicated thing. It used to be like when I was first diagnosed, it said that my prognosis was like 2 years. You can go 2 years without being treated, and before like you can pass away.
Oh,
And
wow.
now, yeah, I know. And I had already been symptomatic for 3 years. So I was like, okay, well, what's going on? So, anyways, I it was really scary at the time. Now, with treatment, it says that you can live a pretty normal life. So that's great. And just because I'm getting checked so often, I feel pretty safe with it. My
Mhm.
doctor's pretty proactive when it comes to treating me and giving me what I need.
That's awesome. Yeah, it's always important when you do have a healthcare team that is understanding and helpful and not as dismissive. But you were mentioning that you had experienced some like medical gaslighting. So just wondering if you could speak a little bit on that in terms of like how that feels and how you continue managing to go to appointments and like how do you walk into an appointment and not be anxious? I mean, I'm assuming you are anxious still going into appointments, but how do you deal with all that?
Um, so I went to I've been to 3 rheumatologists total,
Mm,
and the first 2 rheumatologists that I went to, yeah, it was just constant medical gaslighting. They weren't doing the right tests, obviously, and they didn't know what to check for. They didn't know to run that ANCA test because that's not normal. Usually, when you go to a rheumatologist, they do like a CBC, a BMP, which is to check your normal labs. They check certain like inflammatory labs, and then they check for like lupus
mhm,
and rheumatoid arthritis, like the RF factor and the ANA. Those are the tests that they do because most of the time that's what people have. It's some kind of like rheumatoid arthritis or lupus, but they don't check for vasculitis. So, which they should. I don't know why they don't, but they should be testing for that. And so they, like I said, my first one told me I had fibromyalgia, sent me to physical therapy. Physical therapy did not help at all.
mm,
Even the physical therapist was like, "Did you get into a car accident?" Because I was so tight up here, and I
mm,
still am. I'm still really tight up here. They do so much to help me with that. But that was the first rheumatologist I went to. The second rheumatologist, because I was not happy with that one, told me that I needed to go to therapy. I needed to see like a psychologist. And it made me feel like this was all just in my head. I was questioning myself, like, am I really just, am I really like not sick? Am I really like what's going on? Maybe it is all in my head. It made me question that a lot. And so I wasn't comfortable with that because even me saying to myself, maybe it is all in my head, I couldn't shake the pain and I couldn't shake the fatigue, and something was wrong. Like, your own body and when
right.
something is wrong. So then I went to this third rheumatologist that was out of my city. I was done with those two other ones. I fired them. I went somewhere else.
Mhm,
But when I saw this third rheumatologist, he was very much like, yeah, something's definitely wrong. Like I
mhm,
can walk, I just walked into the room and I could see the swelling in your hands.
oh,
And so he was very proactive in like trying to get down to the root of it and then starting treatment as soon as he found out what was wrong.
mm,
So, and then if one treatment didn't work, he would try something else and he would try something else. And he kept kind of pushing.
mm,
So I've been with him ever since. He's the one that found my Wegener's disease. He found my psoriatic arthritis. So, I've kind of stuck with him ever since. But yeah, the medical gaslighting had been horrible for
mm.
3 years. I went through that for 3 years.
That's unfortunate for sure. Would you say that you mentioned you're an RN, and so
Mhm.
would you say that your medical experience either, like, helped or hindered, you getting the care, like, if you know what I mean?
I felt like it helped a little bit when it came to, um, me trying to get lab work done that was I needed to see something.
Mm,
Like, I understand and I respect the diagnosis of fibromyalgia, but to me, I knew that something had to be like concrete for me to see. Like I know there's a lab out there that's going to show something because there is no way that I could feel the way that I'm feeling and there not be some kind of lab that's showing or reflecting what I'm feeling.
mhm,
So I think that that helped a little bit. It helped to kind of do my own research and put puzzle pieces together to try to figure that out. But I mean, even as an RN, I feel like, you know, it doesn't mean that we're any more respected than anybody else that's not in the medical community. They
right,
kind of just make you feel like you're stupid. And like the doctors make you feel like you're stupid, like you don't know what you're talking about.
mm.
Doesn't matter what health profession you're in or what profession you're in. It was just a horrible, horrible experience to go through the medical gaslighting.
Yeah, for sure, and that's interesting that you're pointing out that, like, even though you have studied the human body and you do have experience. It's not like you are just coming in with no background of medical experience and you're still feeling those feelings of medical gaslighting. That's absolutely crazy. But when you
Mhm.
did end up getting the diagnosis, did you ever feel like a relief off your shoulder that you got? Like, what did that feel like, and how did that contribute to your future appointments of, like, knowing that you have a diagnosis?
After I was diagnosed, it made me feel a little bit better.
Mm,
Not It was kind of like a relief in the sense that it wasn't all in my head. Like, I'm not crazy. There is something wrong with me, and I knew there was something wrong with me. It also, like, the people that are undiagnosed right now, because I think that we've all been there at one point in our journey. Um, it feels like I don't wanna have a diagnosis. I don't want to be sick, but it's also at the same time, it's not something that we ask for,
mm,
and the only reason we want a diagnosis is so that way we can get treatment, get the correct treatment.
right.
And for me, it's been a journey. And just know, like, if you are at the point right now where you're not diagnosed, and you're waiting for a diagnosis, even though you get that diagnosis, you might still be going through treatment and different medications here and there until you find something that works for you and your body. And then, of course, there's also a chance that once you do find a right treatment and it works for a little while, it'll just work for a little while and then you'll have to move on to something else,
Mhm.
which is something that I think a lot of us go through.
For sure, yeah. Yeah, the realities of having a chronic illness for sure. And so
Mhm.
if we're jumping to your day-to-day life, what would you say some of, like, the challenges you face on, like, a daily or weekly basis? And do you have any coping strategies that you figured out for those symptoms?
Challenges on a day to day basis is just the unpredictability of flares.
Mm,
I never know when it's going to be a good day for me or when it's going to be a bad day for me. And for me, who still has a full-time job, that's really hard.
mm,
I am no longer working on the field as a nurse. I've been a hospice nurse for 12 years, and I've been working out on the field, going to see patients in their home and facilities, doing all of that. But I had to stop doing that 2 years ago because of the flares and the unpredictability of flares. And I've always been a really hard worker,
mm,
um, but I had to stop because I didn't want to feel like I was not dependable anymore, which is
mm,
not me and my work ethic. So I do work from home now. Um, I work doing hospice triage across the United States in several states. But even then, even just working from home with the chronic pain and chronic fatigue and having to sit up and all of that, it's been really hard on my body. And so, I sometimes I can't stay awake and I have to like really push myself and really force myself to stay awake for my job. And I have to work. I have to pay my bills. So, but I think that's been one of the challenges is the unpredictability. Now, some ways that I kind of cope with that,
yeah.
and is I live in a two-story house, so it's been really tough for me to go up and down the stairs, especially in a timely manner where I only have like 15-minute breaks.
Right.
It's gonna take me like 5 minutes just to go up the stairs or just to go down the stairs, and I
Right.
can't waste my whole break. So, I have in my room like a mini kitchen. I have a little pantry, I have a coffee maker, a toaster, a little fridge, a microwave, so that way I can kind of prep ahead of time. That way, if I am working and I am having a flare, I have everything that I need here and I don't have to waste my energy going up and down the stairs. So that's one way I cope. Another way is I have two of my children that live here with me in the home and do school at home. So they're always ready and willing to help me. They know and see what I go through every day. So, especially my younger one, she'll just come upstairs and be like, I made you a peanut butter and jelly sandwich.
Oh,
I'm like, aw, okay. So, yeah, she really helps me a lot. Both of them do.
that's so sweet. And so, on that note, how has it been? Like, I speak to a lot of people who don't have children, and there's only been a few people that I've spoken to who are mums. And so, I'm just wondering how it is coping with being a mother and having chronic illnesses, and what that's been like.
It's been tough. Like when I was first diagnosed with the Wegener's disease and had to explain what it was to my kids. My son, oh gosh, I can't even remember how old he was. He was younger. I want to say he was 10 or maybe 12. But when I talked to him about it, I remember he was just very clingy with me. He cried. He didn't want to leave my side. He was just, I think he felt like I was going to die.
Mm,
Um, but as far as like being a mother, it's been very tough for me mentally and emotionally, especially when I'm flaring because it feels like my kids are having to take care of me.
mm,
And when you're a mom, you feel like you're supposed to take care of your kids. And so how do you deal with that like mentally? How do you it's still different. It's still difficult for me to cope with that.
mm,
I don't like that they have to help me with things, and that's another reason why I have everything here, like my little kitchenette up here, is because I like my independence and I don't want to have to keep asking them for things. I want them to enjoy their childhood and not feel like they're having to mother me.
mm. Yeah, no, totally fair. I've heard one person as well say that a similar effect of like the fact that they became like the clingy and whatnot. But how are they doing now that you've had it for a while? You're on treatments. Do you find that it's still the same type of feelings of like worriness for you, or do you think that's like mitigated a little bit?
Mm, sometimes I don't feel like it's as bad.
Mm,
Um, with my younger one, like I said, she's a little more clingy and always willing to help me when I'm walking. And she knows that I don't have like my walker, my wheelchair with me. She'll get her hand like this and she wants like so I can put pressure on it as if she were my walker. She's so cute. But that's how she is, like, whenever, like, I'm walking, ambulating, and she's next to me. So she's not clingy, but she's a little more protective, I think.
yeah, that's interesting. I'm sure she'll work in the healthcare field and somehow when she gets older as well.
I think so too. I hate to admit that, but I think so too.
That's so sweet. My next question is just about like you were mentioning you have the kitchenette style in your bedroom. I'm wondering if there's anything else you do in your daily life that you either like use on a daily basis or weekly basis to mitigate symptoms, or if there's any drinks in particular, recommendations for products, anything like that that comes to mind.
Mm, recommendations for products. I have I always have, like, a heating pad of all I have all
Mm,
kinds of heating pads. But the one that helps me, I think, the most, and I just kind of put it everywhere, even though it's kind of supposed to be up here, is the one that it kind of, like, goes around my shoulders, and I can kind of hold it there, or it buttons in, but I can kind of, like, tie it into the position that I want just because I have so many problems with my shoulders up here. I have a decompression belt for my lower back that has a heating pad and red light therapy that helps me too.
mm,
Um, for me in particular now, I have compression socks. Those help me a lot.
mm,
For some reason, I've been having issues a lot with my blood pressure and pulse being really high. Um, three doctors think I have POTS. So I'm going to go see the dysautonomia specialist in September
mm,
for that to check for that. But Compression socks help. Always having everything like right here where I need it. Like I always have emergency medications in my
Mm,
little pill sorter always next to me. I always have like my little emergency bag next to me, like everywhere that I go. And that has like my blood pressure cuff, my emergency medications, my what else do I have in like lip balm.
mhm.
Um, let's see what else I have in here. I have all kinds of stuff, like little Tic Tacs, muscle rub, um, the Biotine to keep my mouth moist, just all kinds of things like tissues, my earplugs. I have everything in there and I carry that everywhere I go. So, like, if I'm going to go downstairs, I'll take my emergency bag with me. And if I'm just here in bed and I know I'm going to be in bed all day long, I will have it on the bed with me.
Mhm.
It just doesn't leave my side. I always have water with me. um, I always have some kind of like coffee, even though I'm not supposed to be drinking coffee because of my pulse. But I always have some kind of coffee with me. Um, there's an app, and I know this is probably one of your questions. There's an app that I use every single day called Bearable.
Oh.
And they don't pay me to say this. I'm not sponsored by them at all, but I absolutely love the Bearable app. So I can track my medications because I can only take my pain medication 4 times a day,
Mm,
and I don't want to run out of it. So it has to be every 6 hours. So I need to make sure I need to keep track of, the times that I take them. I can only take my Zofran, my nausea medication, 3 times a day. So I need to keep track of that. Um, and then I keep track of like when I took my vitamins, when I took my metoprolol for my blood pressure, when I took everything, because brain fog, we forget.
yeah.
Did I take my meds? Oh yeah, I took my medications. Like you have to know these things. So it's really helped me to kind of like stay on track with that. And on there, you can also put your symptoms. You can also put like if you had a bowel movement, if you want to keep track of that and how it was. Like there's like it's so weird because it's like specific on like what kind of bowel movement did you have? Okay, that's a little weird, but yeah, like everything is on that app to kind of help you with your doctor's appointments and when you had a migraine last, because I can't, every time I go to get my Botox for my migraines, I have to fill out a sheet that says like how many migraines did you have in the last 3 months. I don't know. So it helps you with that too.
Yeah, for sure. As you're speaking, I realized that I didn't take my medication this afternoon, which means I probably should look into getting that app as well.
Yeah, see.
Exactly. It seems like it's going to come in handy for sure.
Yeah.
My next question for you is just about empowerment, advocacy. I know you are on social media. What made you want to start a social media account and kind of speak up about your health, chronic health conditions?
For a few reasons, but I think I guess top two reasons is to help other people, of course. There I feel like when I was starting my journey, I needed somebody to be understanding on what I was going through, the symptoms that I was having. And it's like a really scary journey, especially in the beginning when you're not diagnosed and you're like, what is wrong with me? And you realize that, other people are going through this too. It makes you feel not so alone.
Mm.
Um, but also I kind of use it as like my personal diary. Like this is this is what I'm going through today, and I need other people to make me feel like I am not alone. So when I post something of this is what I'm going through today and I'm in so much pain and I'm having a lot of fatigue, and then you see comments like, just hang in there, like encouraging you, but also saying things like, I'm going through the same thing, and, sending you spoons and love. Like it just makes you feel a little bit better.
Yeah, for sure. So it kind of is a two-way streak, which is really nice and sweet. That's so nice.
Yeah.
That's awesome. Before we get to our last question, I always ask everyone who comes on. It does not have to be anything related to chronic health, but I'm wondering if there's any like shows, movies, or books that you're like really into right now.
Oh, right now.
It doesn't have to be health related at all. If it just recommendations.
I have no idea. I I'm looking for things to
Mm.
watch. I feel like I've seen everything, but I think my top the top things that I've kind of been watching are um biographical dramas
Ooh.
and true crime.
Netflix just came out with quite a few more true crime ones that I'm looking forward to watching. Yeah.
Yeah.
Awesome. And then my last question here for us today is I'm just wondering if somebody is listening in right now and they're either like starting their health journey, they're maybe undiagnosed or they're just in the middle of a flare. Do you have any like words of encouragement or words of advice for them?
Hang in there.
Mm,
I think that would have been what I wanted to hear at the time. Just hang in there because and to keep going. Don't give up.
very nice. Wonderful.
Yeah.
Yeah, amazing. Well, thank you so much for joining me. I do appreciate you taking the time.
Yeah, of course. Thanks for inviting me to do this.